Now we'll be continuing the abdominal inspection. We're going to inspect the contour, symmetry, pulsations in the umbilicus, and we'll see if there's any bruising noted. First, we're going to osculate for the bowel sounds. So I'll just tuck this up a little bit. We'll start in the first quadrant and work our way over. And there's positive bowel sounds in all 4 quadrants. And then we're going to osculate the aorta. And there's no bruits heard. And next we're going to palpate all 4 quadrants, starting with shallow, and then deep. And then next we're going to palpate the liver, and then the spleen, and then both kidneys, and the aorta, to make sure it's midline. And then we're going to percuss the liver height, and then all 4 quadrants. And then next, you can roll this down for now, we're going to check the inguinal area, and we're going to palpate for the femoral pulse and also the lymph, horizontal and vertical lymph nodes. And this is where we would instruct the testicular self-exam. And now we'll be checking the posterior side of the chest. So if you could sit up. I need your back. Probably facing. And next we'll just be inspecting the skin and the symmetry of the back. And then we'll be palpating the thyroid gland, and then the spinous process, and then we'll be doing the testing for tactile firmitus and make sure it's equal on both sides. So when the patient talks, there should be a vibration, and that's what we're checking for. So every time I put my arms on your back, you can say 99,
99, 99, 99, 99.
Good. And we'll make sure that there's symmetric expansion. And next we're going to percuss the lungs. You could take a deep breath for me. And another one. Another one. And one more. And we'll notice that the sound is resonance, and that we are noticing diaphragmatic excursion. And now we're going to osculate the breath sounds. So if you take a deep breath every time I place my stethoscope. Okay, good. And now we're going to move to the anterior chest and the cardiac. You want to spin that towards me, please? We're then going to notice the symmetry of the chest and that her respiratory is unlabored and that her jugular distension is normal with a supine position. And then we're going to start to palpate the carotid artery. And then also the apical pulse. And then we're going to notice that there's no tenderness, lumps, and we're also palpating the lymph nodes. And also on this side doing tactile fremitus. So every time I put my hand, if you say 99.
99, 99, 99.
Okay. And then at this time, we would instruct the breast palpation on the model. And next we're going to listen to the carotid brute on both sides. And then now we're going to listen to the rate and rhythm of the heart. And then also we're going to listen for the sounds of the heart in all 5 positions. And now also we're going to listen with the bell end of the stethoscope. And now we're going to listen to the breath sounds bilaterally on the front of the chest. So if you could take a deep breath every time I put my stethoscope down. Okay. And now we're just going to check for murmurs. So if you could just lean forward. And there are no murmurs. So then we'll move to our upper extremity portion of the head to toe assessment.